Hi, my name is Dr. Arnold, and in this episode, I'm going to be talking about the breakdown of pay as a dental associate. So many dental students have been asking me how that breakdown actually looks when you get paid month on month. So what I'm going to be doing is I'm going to be going over the same month in 2019, in 2020, and in 2021 to show you the difference over the years and to show you the breakdown of how things like pay from NHS, pay from private work, as well as costs, the lab bills that you have to pay out, and the pension contributions, how that all starts to look. So I hope you find it useful. So make sure to subscribe also if you want more videos like this, which is starting to really show you what life is like as a dental associate. Before we get into the specific breakdowns, we first need to understand how some of these things work in relation to income. So I'm going to take myself for example. In terms of income, there's three different ways that I get paid. So I work in a mixed practice that provides NHS and private dental care. Within the private side of things, I can get paid by patients who choose to have private treatments with me, and they pay for whatever treatment that they have done. I have some patients who will be on a payment plan, almost like an insurance-based plan, where they pay a certain amount to the practice in order for me to maintain their oral health. So they'll have a monthly payment that they make, and it'll cover things such as their regular checkups, simple treatment will be covered, and it means that when they need treatment, that most of their costs are covered in their regular monthly payment. So we've got patients who pay privately for each thing they have done, which we call private pay-as-you-go patients. We have patients that are on a plan. So the plan that we use is called Denplan. So these patients will pay through that plan. Then you have patients that are paying for their treatment under the NHS. So they will pay NHS fees. And whenever I do a course of treatment for a patient, they may that course of treatment may fall under a band 1, a band 2, or a band 3 course of treatment. And whichever band it falls under determines how many UDAs, units of dental activity, I will then get paid. So for example, a band 1 course of treatment, where a patient might pay about 22 or so pounds, that will generate a band 1, and that will generate 1 UDA. So that leads on to the UDA contract that I'm on, which is £11 a UDA. So for 1 UDA, I will get paid £11. So again, let's just refresh that. The patient might have a band 1 course of treatment. They pay about 22 or so pounds. I get 1 UDA generated from that course of treatment. Let's say it's a checkup. And then from that 1 UDA, it means that I get paid £11 under the NHS. Okay, so that's just a quick overview of how the income works for private treatment and for NHS treatment. Now that we've got the income side of things taken care of, now we're going to look at the deductions. The main deduction that will get taken off from the pay is the lab bills. So whenever you're doing treatments and let's say you're making crowns or you're making bridges for patients, those crowns and bridges are made by lab technicians. They fabricate, they make these crowns, they make these bridges to your prescription, which I'm then able to fit on my patients. Now for the lab technicians to do their job, it means that there's a fee to that. And depending on the complexity and how big the job is, it depends on how much of a lab bill is generated. So if you're doing a lot of crowns and bridges, maybe dentures, that will generate a lot more lab bills, and this will be taken off, deducted off of the income that you've generated for that month. So we've got income from private pay-as-you-go patients, we've got income from insurance-based paying patients like Denplan, you've got income from patients that pay under the NHS, and then the first deduction we look at is the lab bills. Another deduction that is to be considered is the pension. So your pension towards the NHS, that counts as a deduction. Also, you have to remember that in your agreement, your contract with the practice owner, it may be that the fees that you generate, the income that you generate from private treatments, there's a split there. So, for example, I have a 50% split with the practice owner, so the income generated from private pay-as-you-go patients, that will have a 50% split. The income from Denplan patients, that has a different split to it. And the income from the NHS, that's all based on the contract, the UDA contract you negotiate. So for however many UDAs you generate, the contract you negotiated with the practice owner will determine how much you get per UDA. So for my situation, it's £11 a UDA. Okay? Hope I've still got you here, but it'll become easier as I explain it using some examples. Okay, so let's get straight into it. So remember, I'm going to be comparing the same month in the year 2019, 2020, and 2021. So if we start with 2019, if we look at Denplan, I was still quite new to the practice as an associate, so I didn't have much off a Denplan list. So Denplan was £150 in terms of income from Denplan. Private pay-as-you-go income, that was £5,300. When you look at those two joined together and then the 50% split between me and the practice owner, that then comes out to £2,725 that I would have got after the 50% split from private income. In terms of NHS income, that month I had achieved 506 UDAs. So remember, my contract is at £11 a UDA. So that means that £5,566 was how much I earned through the NHS when you take into account my UDA contract. Now, adding up the private income and NHS income, that comes out to £8,291. Lab bills deducting the pension, the deductions came up to £2,100, but because the deductions are shared between myself and the practice owner, the deductions for me were £1,050. So in total, the net for that month in 2019 ended up being £7,241. So I'm using rounded numbers in some of these calculations just for ease of explaining all of this. But for that month in 2019, it was £7,241. Okay, so if we move on a year later, 2020, I'm a bit more used to the practice, to working as an associate. I've got into a rhythm, a routine within the practice. In terms of Denplan, I had a much bigger list at this point. So income due to Denplan was £2,000. Privately, I was doing a lot more private treatment, mainly Invisalign, and the private income for that month was £10,000. So together the private income was £12,000, and after you do the 50% split, it meant that I had £6,000 income from private work and private treatments. For that month, under the NHS, I had completed 514 UDAs. So my UDA output was very similar, but I was probably more efficient because I was able to do more private work as well as maintain my UDA commitment at that time. So 514 UDAs, that meant that through the NHS, I earned £5,654. So in total, the income was £11,654. Remember, there's the deductions, lab bills and NHS. So when you take down the deductions, which on that month they were £2,200, you were left, or I was left with £9,454. So there was a steady increase from the year before, looking at the same month. And that was mainly down to me becoming more efficient, being more familiar with the place, with the practice, with the patients, and more patients were choosing to have private treatment with myself. Now we come to 2021. We've had the pandemic, we've had the lockdowns in 2020. Things are now picking up at this time in 2021. Services are running as close to normal as possible. So in terms of looking at the same month in 2021, Denplan list, roughly the same, but I had renegotiated the contract with my practice owner, so I was actually taking a bit less from Denplan just to help with costs. So my Denplan amount for that month was £1,500. My private income for that month was at £42,500. So at this time, a lot more private treatment was being carried out. I was able to carry out a lot more private treatment. Introduction of virtual consultations, being able to speak with people over video, over Zoom, that definitely helped to increase the capacity or the amount of people I could see for private treatment. So in total, I earned 44,000 in terms of income privately. When you do the 50% split, it meant that I was at £22,000 income privately. For the NHS, things are different in that we are not able to carry out the same amount of UDAs due to things like fallow time and just protocols that are set up in practice. So in order to maintain the NHS UDAs that I was committing to, there was a target that I had to reach to earn a similar amount. So I have been reaching that target. So under the NHS, I earned £4,500. So when you take all of that into account, it was £26,500 after the 50% splits. One thing that I changed is that I'm now doing 1 day a month doing orthodontic treatment at another practice. So through that practice, that brought in £3,500 extra after the 50% split. So in total, my income was £30,000 after 50% splits between the two practices. In terms of lab bills and costs, pension, that came up to £5,000. So that meant that the net after all of that was £25,000 for that same month in 2021. So as you can see, there has been an increase year on year, and that's mostly down to being able to carry out more private treatment, being able to feel more confident and more familiar with the practice, the staff, everybody else, and also the effect that Zoom has had on the way people are seeing more of their teeth on screen and wanting to do something about it. So I've been able to carry out more orthodontic treatment and that's shown through my activity in terms of private treatment. But one thing that I can say is you can never tell how much you're going to earn month on month as a dental associate. You can get a rough idea, but it's impossible to say exactly how much you'll earn as a dental associate month on month. So whenever people ask that question, how much can you expect to earn, monthly? I don't even know. I don't even know how much I'm going to earn each month. I don't know how much I'm going to earn this month, just because when you take into account private income, NHS income, it's only once you've done the month and then everything is all added up and costs are deducted that you do get a number. I hope that has been helpful in getting a little bit more insight into how pay works for dental associates, getting a bit of a breakdown. Everyone's numbers are going to be different. And really, at the end of the day, it's not about the income you're making, it's about the patients that you're serving and the patients that you're able to maintain, the patients that you're able to keep happy, keep in a healthy condition. And if you look after the patients will look after you. That's something that I go by. So guys, if you have enjoyed this video, make sure to press the like button, subscribe so you can catch more videos like this. Put in the comments section, what other videos would you like to see me do? And I'll try and make videos catered towards your suggestions. People were suggesting this type of video, so I made this video to break down those numbers for you. I will see you guys at the next one.